Peace. Welcome to the YouTube live book reading of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Peace. I'm your moderator and narrator, Uriel Riley. So, welcome, YouTube. Peace. It's time. We're live book reading, right? We are in chapter 7. Chapter 7. We pick up at page 138 down at the bottom. Welcome, YouTube. Peace and highest heart love. Happy beloved birthday, heavenly birthday to the great Kobe Bryant. Kobe, we love you so much. As you see him back here, it's a poster. I want to give love and honor to one of the greatest of all time. He worked so hard. I actually had the pleasure of playing a few games with him in the summer. So really want to honor him. That's also why I wanted to come back on, show love to the great Kobe Bryant, dedicating this reading to him. Low flow oxygen systems. Peace. The low flow system does not provide sufficient gas to supply the entire inspired atmosphere. Therefore, part of the tidal volume must be supplied by breathing room air. Any concentration of oxygen from 21% to 90% can be provided by such a system. The variables controlling FiO2 are 1. The capacity of the available oxygen reservoir, and 2. The oxygen flow, L over minute, and 3. The patient's ventilatory pattern. These systems are used because of tradition, familiarity, and patient comfort, economics, and availability, not because of accuracy or dependability. In principle, low flow systems depend primarily upon the existence of a reservoir of oxygen and its dilution with room air. To demonstrate the use of low flow systems, let us consider a normal person with a normal ventilatory pattern. Peace, highest heart, love, Coco, Elo, shoot. My mind is in the building. Highest heart, love. I'm excited. We're giving love to Kobe. So I wanted to come back on here and do double up. In principle, low flow systems depend primarily upon the existence of a reservoir of oxygen and its dilution with room air. To demonstrate the use of low flow systems, let us consider a normal person with a normal ventilatory pattern. Tidal volume, VT, 500 milliliters. Ventilatory rate, RR, would be 20 over minute. And inspiratory time would be 1 second. Expiratory time would be 2 seconds. And anatomic reservoir would be 50 milliliters. The anatomic reservoir is composed of the nose, the nasopharynx, and the oropharynx, figure 7.3. We will assume that the volume of the anatomic reservoir is one-third of the anatomic dead space. Therefore, 1 over 3, or one-third, times 150 milliliters equals 50 milliliters. A nasal cannula with an oxygen flow of 6 liters over minute, 100 milliliters over second, is placed on this patient. We can safely assume that most of the expired flow occurs during the first 1.5 seconds. 75% of the expiratory time, i.e., the last zero point 0.5 seconds of expiration, has negligible expired gas flow. This allows the anatomic reservoir to fill completely with 100% oxygen because the flow rate is 50 milliliters over zero point 0.5 seconds, 100 milliliters a second. Assuming all oxygen supplied by the cannula and contained in the anatomic reservoir is inspired by the patient, the next 500 milliliters tidal volume, which takes 1 second, is composed of 50 milliliters of 100% oxygen from the anatomic reservoir, 100 milliliters of 100% of oxygen supplied by the cannula flow rate, 350 milliliters of 20% oxygen room air, thus 0.20 times 350 milliliters equals 70 milliliters of oxygen. The 500 milliliters of inspired gas contains 220 milliliters of 100% oxygen. 50 milliliters plus 100 milliliters plus 70 milliliters equals 220 milliliters. We calculate 220 ml oxygen over 500 milliliters equals 44% oxygen. Yes, this is so good. Thank you for reading with us. Hi, it's Heart Love. We're reading Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. Thank you so much for reading with us. Oh, yes, peace. Hi, Ayala Vani. Thank you so much for being here and reading with us. Hi, it's Heart Love. Thank you for this corner of YouTube where we read books and learn from masters. I'm a master fitness trainer, Uriel Neville Riley. We are reading Chapter 7, Oxygen Therapy, down at the bottom of page 139. Thank you so much for reading with us. Hi, it's Heart Love. This means that a patient with an ideal ventilatory pattern who receives 6 liters over minute of oxygen flow by nasal cannula is receiving an FiO2 of 44%. If we compute for this person all flows from 1 liter to 6 liters by nasal cannula or catheter, we see that for every liter per minute change in flow rate, there is approximately a 4% change in the inspired oxygen fraction. Table 7.2. All right, this is figure 7.3. Thank you for the likes and subs. We're almost pushing the 500 reading books here on YouTube, the peaceful part of YouTube where we read books and learn from masters. So 7.3, it shows the anatomic reservoir, the mask, and the reservoir bag. Okay, and I'll read it for you after I show you. There you go. Thank you so much for reading with us. Clinical Application of Respiratory Care. Chapter 7, The This is the second edition, 1979. And you see, I'm in black because we're in the black new moon. Yes, and it's August. Much love. Thank you so much for the likes and subs. It's special. It's very special. It's also Kobe's birthday. So, always showing love to legends and masters on this channel. And he was one of the true masters. I had the pleasure of being able to play against him in some games in the summer, being that I was from South Jersey. So, man, just always want to give reverence, right? That's what this channel is for uplifting everyone, inspiring, giving information so we can master thyself. So, what it says for 7.3 is reservoirs in low flow oxygen therapy. The anatomic reservoir consists of the nose, the nasopharynx, and the oropharynx. This reservoir is estimated to be approximately 1/3 of the anatomic dead space. The appliance reservoir consists of 1. The mask, 100 to 200 milliliters volume, depending on the appliance, and 2. The reservoir bag, 600 to 1,000 milliliters of added volume. From Shapiro, B.A., Harrison, R.A., and Walton, J.R., Clinical Application of Blood Gases, 2nd edition, Chicago, Yearbook Medical Publishers, Inc., 1977. Page 141. Table 7.2, guidelines for estimating FiO2 with low flow oxygen devices. Okay, so it has A, and the nasal cannula or catheter, and the percentage of the FiO2 on the side. This is very key. You know what I'm saying? After that, after the nasal cannula is B, is oxygen mask, and then C is mask with reservoir bag. Okay, so this is the O2 and flow rate right here in the first side where you see A, B, C, and FiO2 percentage on the opposite. Top of page 141. Thank you so much for reading with us. Highest heart love. I want to make sure you get it. I'll read it off always so that we make sure we get a full understanding, right? Says A, nasal cannula or catheter, 1 to the FiO2 percentage, 24, 2, 28, 3 is 32, 4 is 36, 5 is 40, 6 equals 44. That's the first number, again, so for you taking notes and also in the playlist, the first number is under A, B, or C, and that's the O2 flow rate in liters, okay? And the second number is the FiO2 percentage. Here we go. So B, with the oxygen mask, 5 to 6 equals FiO2 of 40. 6 to 7 equals 50. 7 to 8 equals 60. And C, mask with reservoir bag, 6 equals 60. 7, 70. 8, 80. 9, 90. 10, 99 plus. And of course, the plus would mean 100%, right? For practical application, we must have some guidelines for estimating the FiO2 that a given low flow apparatus with a given oxygen flow will deliver to a patient. It is essential to understand that the FiO2 in a low flow system varies tremendously with changes in tidal volume and ventilatory pattern. Let us consider the same patient with his tidal volume reduced by half, 250 milliliters instead of 500 milliliters. The quantities now are 50 milliliters of 100% oxygen from the anatomic reservoir, 100 milliliters of 100% oxygen determined by the cannula flow rate, 100 milliliters of 20% oxygen room air. Thus, the 250 milliliters of inspired gas contains 170 milliliters of 100% oxygen, 50 milliliters plus 100 milliliters plus 20 milliliters equals 170 milliliters, we calculate. 170 milliliters of oxygen over 250 milliliters, which would equal 68% oxygen. In a low flow system, the larger the tidal volume, the lower the FiO2, or the smaller the tidal volume, the higher the FiO2. A low flow system delivers consistent oxygen concentrations as long as the ventilatory pattern is unchanged. Ding! See, that's a big one, right? Because if we control the ventilatory pattern, then we can track the increases and decreases. Oh, this is awesome. Thank you so much. Highest Heart Love. Thank you for being here and reading books with us in this peaceful part of YouTube where we read books and learn from masters. Highest Heart Love and Honor. A low flow system delivers consistent oxygen concentrations as long as the ventilatory pattern is unchanged. However, it is erroneous to assume that a nasal cannula guarantees low concentration oxygen. Obviously, a 1 or 2 liter oxygen flow in a patient breathing shallowly can deliver much higher oxygen concentrations than one would be led to believe. A nasal cannula can be used as long as the nasal passages are patent, since mouth breathing does not affect FiO2. The airflow in the oropharynx creates a Bernoulli effect in the nasopharynx, and air is inspired through the nose. Remember, the nasal passages must be patent. A nasal cannula or catheter with more than a 6 liter flow does little to increase inspired oxygen concentrations, primarily because the anatomic reservoir is filled. Thus, in order to provide a higher FiO2 with a low flow system, one has to increase the size of the oxygen reservoir. This is accomplished by placing a mask over the nose and mouth, thus increasing the volume of the potential oxygen reservoir. See figure 7.3. This type of apparatus gives the inspired oxygen concentration shown in Table 7.2b as long as the ventilatory pattern is normal. An oxygen mask should never be run at less than a 5-liter flow. Otherwise, exhaled air accumulating in the mask reservoir might be rebreathed. Above 5 liters a minute over minute, most of the exhaled air will be flushed from the mask. Above an 8-liter flow, there is a little increase in the inspired oxygen concentration because of the reservoir is filled. Of course, changes in ventilatory pattern are as important in affecting the inspired oxygen concentrations as they are with the cannula and the catheter. To deliver more than 60% oxygen by a low flow system, one must again increase the oxygen reservoir. See Figure 7.3. This is accomplished by attaching a reservoir bag to the mask. See Table 7.2c. Without a one-way valve between the bag and mask, the apparatus is called a partial rebreathing mask. This bag is neither a carbon dioxide reservoir nor a rebreathing bag. It is meant to be an oxygen reservoir. Therefore, the bag must never be totally collapsed during inspiration. The very early exhaled air, the first one third of exhalation, will go back into the bag. This is dead space air from the mouth and the trachea and contains little carbon dioxide. Again, it must be remembered that this is a low flow system in which the inspired oxygen concentrations vary according to the ventilatory pattern. At flow rates from 6 to 10 liters per minute, a closed fitting mask with reservoir bag gives approximately 60 to 90% plus oxygen. Summary. With these basic guidelines for oxygen administration in mind, one can readily provide a patient with a consistent and predictable oxygen concentration. Increasing or decreasing the inspired oxygen concentrations within reasonably predictable limits is possible. And most important, we can deliver a consistent oxygen concentration. A patient with a shallow, deep, or irregular ventilatory pattern should receive oxygen therapy from a high flow system rather than from a low flow system. It must be clearly understood that even though the term low flow oxygen is generally considered to mean low concentrations oxygen, this may not be the case. The ventilatory pattern must be assessed. As long as oxygen administration is consistent, the predictable clinical observations plus blood gas measurement will assure proper oxygen therapy. Wow, so good. Let's pause right here. 143, page 143. I love you. Right, 143. We'll pause right here at the top of page 143. And when we reconvene, we will go into the final reading of chapter. Well, might not be the final reading, might be the second, but we'll see, right? Last reading of chapter 7, Oxygen Therapy. Hi, it's Heart Love. Welcome. Thank you so much for reading with us live here on YouTube. We're pushing to 500 subs in this peaceful place on YouTube where we just read books. Well, I guess not just, right? Because this is not easy work, right? This is vocabulary has to be stellar to embrace this information and wisdom and knowledge. So we take our time with this work. Thank you so much for being here. It's Black Moon, Black, Black Moon. That's why we did it. Show love and reverence. Great Kobe Bryant, to our family and friends, to gratitude, information for all that you've given us, all the ways that have been trailblazed. We honor you. Thank you. We give this information for free because we love you. I love you. Mm. Oh, that's so good. Highest heart, love, and honor. place on YouTube where we shake it up, reading books. Coco Elosion. Peace, feed, gratitude, and highest heart love. Oh my goodness. Thank you so much. Highest heart love. Thank you for being here. Love to my mods, my family, and friends. I wish we had another clean reading, and I will see you soon. We'll continue back, okay? Thank you so much. Yes. Yes, I see the hearts. Oh my goodness, so much love. Thank you so much. Love and honor. I love you. You know it. Peace, peace. Thank you so much. Oh, thank you. And you donated highest heart love. Thank you so much. Much honor. I will see you soon. Yeah, we do this for free. So, man, oh, it's much accepted and only nothing but the highest heart love for you. Thank you so much. Peace, peace.